Hi, dear friends. It is a big pleasure for me as the principal investigator, together with Gustavo Espina and Jan Baker of Andromeda's CHOC 2, to introduce our training program. Andromeda 2, will test the hypothesis that the CRT-targeted septic shock resuscitation together with clinical hemodynamic phenotyping will rationalize interventions, fluids particularly, and through this way, probably decrease morbidity and mortality. Andromeda CHOC 2 is an ambitious project which will be conducted in around 90 countries or centers, around the world, and is aimed at recruiting 1,500 patients and will randomize early septic shock patients between two strategies. One is CRT targeted and hemodynamic phenotype based algorithm and resuscitation, and the other with just usual care. What do you do everywhere? And for 6 hours, and then just periodic monitoring until 28 and 90 days of long-term survival. Our primary outcome, as you know, is the hierarchical or combined primary outcome of 3 elements. One is mortality at 28 days. The second is organ support free days, truncate at 28 days, and the other is hospital length of stay, also in the range of 28 days, in a sort of a statistical analysis that is the win rate. So it's a very ambitious project, very complex in the design, especially in the setting, in how to put this to launch this in real practice. And for this reason, we have developed a very comprehensive educational program that relies on 3 aspects. One is the manual of operations, which is a very nice piece of work that somehow it explores every step of the protocol in depth, and very nicely has some super links that allow you to go to the YouTube channel to watch videos that explain and discuss very different aspects of the algorithm, including how to assess CRT, how to assess fluid responsiveness, how to follow the algorithm in a very didactic way, and when and how to use the vasopressor test, inodulator test, when and how do you use the echocardiography, etc. So it's a very nice package, which contains at least 16 videos and the manual of operation linked with it, and the YouTube channels in Spanish and English, according to the place where the protocol will be held. And third, and more and as important, in apps, educational apps that every medical operator involved in conducting the study at the bedside will have to approve this course in an app, a very nice application, very friendly, where you will have to follow and respond questions about the management of different clinical scenarios with the protocol. This huge effort of developing this training package is very relevant, since to be successful and to really demonstrate a gradient of interventions between the interventional group, where we expect less fluids, more rational vasoactive drugs, etc., versus the usual care group, we will have to follow the algorithm when the patient is randomized to that group very strictly, with rigor. Meaning that if you have a pulse pressure, for example, of 42, you cannot go directly to fluids. You should first assess diastolic blood pressure, etc. And if you have a pulse pressure of 35, you cannot try to play with the norepinephrine. You should assess fluid responsiveness, etc., etc. And if you have a normal CRT, you should stop resuscitation monitored periodically during the 6 hours. So the page, for our opinion, maybe we are in love with this study. The algorithm is very nice, it's very beautiful, it's very physiologically sound. It has probably all, it's oriented to decrease mortality and mortality through a more physiological based protocol, but with clinical tools like CRT, looking at the arterial pressure monitoring that are available almost everywhere. So this is an invitation to enjoy the training package. We will release it to everybody, but when a center enters just the track for starting recruiting soon, there will be 8 weeks of supervised activities that includes 3 weeks of training where every actor has to go over this training package and will be evaluated. And only when the center is ready, we will start opening it to recruit. So please enjoy, and thank you so much for being part of this effort. Thanks.